are you doing today?
Doing good. How about
Thanks
you?
for the great presentation on vertical dimension for our staff. You know, it's a challenging subject to present to our group because we have new technicians in the group, technicians with a lot of experience, full art technicians, so we had a mixed crowd. So I know you tried to explain it in a way that would relate to everybody. Why do you think that's such a good subject for dental technicians to be aware of?
Because I think that vertical dimension is maybe the main factor in the total success or failure of a full arch case. Too much VDO can cause problems, not enough VDO can cause problems. So arriving at the sweet spot for vertical dimension is key for the long-term success of our cases.
So I know a lot of times we, being our clients and the lab technician, kind of reestablish vertical dimension along the way. What kind of records do you find are most successful for dentists to provide us to confirm and provide that vertical dimension position that we want to restore to?
We start out with a bite and an articulation, and if there are teeth in place, and anterior teeth in place, upper and lower, we can use what's called a shimbashi to measure, and from the CEJ of an upper central to the CEJ of the corresponding lower central with teeth in occlusion, we can make a measurement, and the range that most people fall in are 17 millimeters to 21. Also, we use something that's called a fold-to-fold measurement, meaning that we put a ruler in the mucobuccal fold on the upper, in the lateral area, and we measure to the mucobuccal fold in the lower lateral area, and we're looking for a range between 35 and 38.
They don't fall within the ranges, and the photos also indicate there might be a challenge. You'll basically question the vertical position and have a conversation about with the doctor about maybe reevaluating it.
What we do is we take photos of the existing position on the articulator, and we take photos of a proposed position. We send those to the doctor, and then we have a conversation about it and discuss if the doctor feels like that he agrees, and we can proceed with that new vertical opening, which is just a starting point.
I know sometimes we send doctors, there's a couple methods that we can help doctors kind of verify the right position, but I know one method is a JC try-in. Can you explain that and how that works?
A JC try-in is nothing more than a plastic partial, if you have to compare it to something. We use JC try-ins for a number of reasons, a few really important ones. One is we'll send those if there are not enough confirming centric stops to be able to handhold an articulation or confirm that this bite is right because there's not enough centric stops to cause a stable bite. And they're all made the same, it's just different purposes for each one. And in orthotic is when we open the bite 3 or more millimeters, we suggest that the doctors give this to their patient and let them wear it for a week or two or however long they think they should to confirm that the joint can tolerate the opening and that the patient's comfortable, they can speak properly, and that the bite is correct. And we also put a couple wire clasps just to hold those in place during that time. So
despite our, all of our efforts to make sure we're getting the right restorative position, hopefully at the diagnostic stage, a printed try-in or a denture setup, what would be some symptoms from the patient if we have vertical dimension open too much?
First of all, the patient would not, when their mouth is at rest, which most people do, and it's a position where you're not forcing your teeth together and your jaw is just kind of hanging freely, that there should be space between your teeth. If in the rest position the patient's teeth touch, that's a major indication that vertical dimension is open too far.
Okay.
That's one. Secondly, when they talk, their teeth will touch when they talk, and that should never happen in natural teeth or replacement teeth, and that's an indication that something's wrong. And their speech will be slurred. They won't be able to pronounce phonetically the words properly that they speak.
I know you have a great presentation on phonetics in dentistry that maybe we'll do at a different time and interview you on. Well, conversely, if we, besides just facially recognizing when we don't open vertical dimension enough and seeing that they're overclosed, besides that, what are some of the symptoms the patient might exhibit if too little vertical dimension has been established?
Most of the time, people can get along better with not enough vertical dimension versus too much.
Okay.
However, physiologically, things happen to their jaw, it starts to move forward. They can start to pronounce words a little incorrectly. Their lips are pushed out. Things like that can affect speech. Mostly, it's just a physiological position that you recognize by photographs that really can be detrimental to a patient's jaw.
Great. Well, thanks for doing the presentation today and sharing these tips for our clients. Appreciate
You're welcome.
it. All right.
My pleasure.
To receive a copy of the Vertical Dimension lecture, please visit www.rodentallab.com/ROE Reviews.